Hey Matthew, how are you today?
I'm great, thank you. How about yourself?
I'm very good. Thank you so much for coming in. I'm really happy to see you. I'm really looking forward to discussing with you the findings from all the exams that we did last week, as well as from the x-rays that we took. Before we dive into all of that, however, I just wanted to find out, do you have any questions about chiropractic, about what we're doing here, or about any of the tests that we did?
Yep.
No? Okay, great. As we go through our discussion today, please feel free to interrupt and stop me at any point if anything's unclear. By the end of our meeting, I want everything to be as clear and concise as possible, so if there's anything that's even a little bit rocky, let me know. Okay? Great. Let's take a look at your films here. So we did a series of x-rays last week to take a look at your spine, and we can use these to talk about how it might be impacting your health. Last week you told me you were experiencing very specific pain in your low back on the left side. You said it was kind of right around this area here. What I'm finding with your pelvic film here is that you have a little bit of a tilt to the hip. So maybe you can tell this side of your hip is a little bit higher than this side. What we're seeing is there's something that's causing your body to be uneven and unlevel. Now, if we look up at the spine here, you can see it's curving a little bit toward the left. That indicates that there's something going on. Maybe it's tight muscles, maybe it's a structural thing, a leg length inequality. There's something that's happening, something that's causing this to happen. Now, Matthew, you do a lot of yoga, right? Perfect. I'm sure you've experienced it in class where if one of your muscles is feeling especially tight or something doesn't feel like it's moving quite as nice as normal, the whole practice kind of feels a little rocky. Have you had that before?
Mm-hmm.
So is it safe to say that one part of your body acting dysfunctionally could impact the whole body?
Mm-hmm.
Yeah, I think so too. When we zoom all the way up from your pelvis to your neck, here's what we see. Now, I'm going to show you a model of a spine. Our spine is made up of a series of curves, and our cervical spine, our neck, kind of makes an arch forward, so it goes toward your chin. On your films here, we're seeing that the lower portion of your neck has almost completely flattened out, and the upper portion is starting to angle forward. So that's not typical. We're not seeing any degeneration of the bones themselves. However, this is the kind of thing that could lead to changes in the structure and cause further complication down the road. Additionally, we're looking at your atlas, the very top bone of the spine. This is the place that your spinal cord leaves and comes in first contact with other structures outside of your skull. Your atlas has a fairly severe tilt to it. So that means that this bone in space has changed its normal direction. If you take a circle and you angle it, you're going to change the width of that circle, as seen from above. So the structures that are running through here suddenly do not have as much space as they're normally used to. This has consequences potentially throughout the whole body. So, like I said, something that's going on in one part of the body might impact the entire system. Right now, you're feeling symptoms down in your low back. However, I'm going to try to address this bone up here. And actually, let me correct myself, Matthew. I'm not going to try to address it. I am going to address this bone right up here. We're going to move it back toward its normal place so that the nervous system structures that are coming out of their skull have less interference, less impedance on them. Okay? We're going to do a technique with you called toggle. That's going to address this bone here. Remember, we didn't just do this x-ray and the pelvic x-ray last week. We did a few x-rays. We took a few specific x-rays of the very top of your neck. We've used that to determine the exact location that your atlas is sitting. When it comes to the adjustment, what this looks like is I'll set you up on a table. I'm going to sit you on a special headpiece that drops about an inch or so. This doesn't hurt. It makes a loud sound, but that's the headpiece falling. When it comes time to adjust, I place one hand on the bone, and you'll feel a little bit of an impulse from my hand into your neck. You'll feel the headpiece drop, and then we'll let you rest for a minute. After a minute or so, I'll move you up, take you to a rest station where you're going to spend about 15 or 20 minutes of downtime. So that means no cell phones, no emails, just relax, take it easy. If you want to bring headphones and listen to something like an audiobook or a meditation, that might be a good idea to spend the time. Sound good? Okay. What we're going to see with that is a chain reaction that could bring about better health throughout your whole body. So adjusting the very top of the neck is going to help how messages are going up and down your spine, and it might actually change how your lower back and your pelvis is situated. Over the next 8 weeks, as we work together, we're going to monitor and see what kind of changes are happening. So when you come in for an adjustment, there's a few things we're going to do. First, we're going to take a thermal scan. I'm going to run this special machine up your neck, and it's going to say where the heat levels are in your skin along your neck. Next, we're going to look at your leg length. So you'll lay down, I'll look at your heels, and I'll notice, is one higher than the other, is one lower than the other. Additionally, we're going to talk about what you're feeling. How is your body integrating? How is it adapting to these changes that we're helping it to make? Okay? Now, some days we'll set you up, we'll adjust you, we'll rest you, and then you'll be on your way. Some days, however, you're going to come in and the foot level, the thermal scan, and what you're reporting might tell me that today isn't a day for an adjustment. So sometimes we actually won't adjust you. We're going to read the signs, and if it says your body's still trying to interpret what's going on with it, we're going to let it be, let it figure it out. We don't want to overstimulate it. We don't want to put too much pressure into it. Okay? Mm-hmm. Perfect. So as part of this plan, I want you to understand that this is a collaborative effort. We're working together toward your health. So my part for that is the adjustment. It's watching your outcomes. It's determining when is the best time to adjust you. And then in a few weeks, we're going to do a reevaluation. Your part in all of this includes some of those at-home exercises I gave you. So when we met, I gave you a sheet that had some exercises. We talked about them and how they're going to help build neck stability. You're going to do those every day before your regular workout. Not every day, but every time you go to work out, you're going to include those kind of as a warm-up. Is that something you can do? Perfect. Additionally, we're going to make a couple little lifestyle changes. Right now, you're saying you're eating about one sugary sweet treat every day. Yeah?
Yeah.
A little bit ashamed of it? It's okay. It's okay. We're going to try to reduce that to one every 3 days. Is that doable?
Yes.
Yeah? You can try. How about one every 2 days?
Okay.
Okay. And in place of those sugary sweets, we're going to try to eat more veggies. I know that's something that you'd like to add more into your life. Just remember, the food that we put into our body becomes our body. So all the things that we bring in are the building blocks for all the structures in our systems. The better food you eat, the better health your body is going to be in because you're giving it better material to build with. The more sugar we eat, the more fast food, the more junk food we eat, the worse state our body is going to be in, the easier it's going to deteriorate. Okay, so although, yes, the chocolate bar, the cupcake is a really nice short-term gain, long-term, we want to think about what is the best thing we can do for ourselves and contribute to that positive building. Okay? So like I said, we're going to meet for 8 weeks. We're going to see each other twice a week to start. When you come in, we'll do those thermal scans, we'll go over some objective and subjective experiences, and we may or may not adjust you. Now, at the end of this 8 weeks, there's going to be a few things we're looking for. Right now, your pain is typically a 3 to 4 out of 10, almost on a daily basis. We want to see that go down to a 1 to 2 out of 10 every few days. So it might not be totally better in 8 weeks, but we want to see a big improvement. As well, you were saying that you have trouble if you have to go up multiple flights of stairs or walk long distances, and that might cause a flare-up of pain. We're going to try to reduce that. We're going to try to eliminate those barriers so that you can walk as much as you want, you can go up as many flights of stairs as you need to without pain. Okay? As well, when we do the thermal scan, we get to record each and every scan that we take. So we can notice how your body is changing and whether or not you keep going into pattern. We want to try to keep you out of pattern for as long as possible. By the end of this, I'd like to see you out of your pattern scan for at least 2 weeks in a row. Okay? Great. Perfect. So I'm going to ask my mentor doc to come in now and say a few words to you about informed consent. This is just going to go over some of the benefits to, some of the risks of chiropractic, just so that you know where you're at and what's involved with all this. Okay? But before I do that, I just want to mention the importance of sticking to the care plan. Right now, we're seeing a few structural changes to your body. So your body isn't in kind of that ideal state. You don't have any degeneration yet. We're going to try to either keep you exactly where you are or bring you better, closer to that ideal perfect state. We don't want you to go forward into degeneration. We don't want to see any arthritis or anything like that pop up. Your body takes, you've experienced this pain for a number of years now, correct? So your body has been used to this. It's been in this certain system, this certain pattern for a long, long time. We want to try to bring you out of that pattern and take you back toward optimal health. Now, since you've experienced this for so long, it's not going to be an instant quick fix. Everything takes time. So it's going to be commitment. It's going to be a little bit of work. Sometimes it might feel a little bit frustrating, but we're going to work through that together and take you to a very healthy place. Okay?
Okay.
Do you have any questions about anything we've talked about? No? Perfect. Okay, I'll go get my mentor doc now to talk to you about informed consent, and then you're free to go after that.
Thank you.
Thank you so much, Matthew. I really appreciate it.
Mm-hmm.